So what we did was what's called a Delphi consensus process, and we took a group of international experts in headache medicine, so there are 21 of us, and we did 5 rounds of a consensus process where we used a survey-like method to try to get people to agree on different questions, where we were trying to build out an international consensus on the definition of refractory migraine. So far, there's been, over the years, various proposals using the term either intractable or refractory migraine. But as of yet, we've never had an agreed upon definition. So there's nothing in, say, the ICHD-3, not even in the appendix. And so when people have studied this, which is in and of itself very infrequent, we've used different definitions that have evolved over the years. So part of our hope by doing this is that we have an agreed definition, and that will help then advocate that we actually study this condition, and that when we study it, we all agree, at least for the time being, what we're studying until we better understand it. And so we've landed with a definition for refractory migraine, and born out of what the European Headache Federation came up with, we also have a definition for resistant migraine. And then we also defined what a treatment responder actually is, and then the concept of probable refractory migraine. We had a very passionate group, and sometimes people who are at opposite ends of the spectrum. So one of the first things that we really needed to agree upon is what the threshold was for being considered refractory. Some people felt that if you tried, 2 to 3 medications and didn't respond, that was enough for refractory, while the other part of the group felt that you really needed to have tried everything. These were the patients who just absolutely nothing worked. And so it was trying to bring those 2 groups together that was probably one of the hardest parts of the project. And I think that's where the European group had come up with the concept of resistant migraine, because what they defined that as is that you have tried at least 3 categories and not responded, while refractory was having tried all categories of evidence-based medicine. The way that we finally got the group to come to a consensus on that point was trying to consider what the point of these criteria were. And the group was able to agree that we really were using them to try to help understand a biological basis for the concept of refractoriness. And so when I posed the question to the group, do you think there is a biological difference between someone who does not respond to 3 treatments but perhaps will respond to something else versus someone who has responded to absolutely nothing? Basically, almost the entire group said yes, biologically those 2 people are probably different. And so based on that point, we were able to say, okay, well then we need to have a group that we're defining as they've not responded to anything, but it is reasonable to have the definition of resistant migraine where these people aren't responding to just the first thing you give them. It still takes several trials before we find something that works. And so that was by far the hardest. And then part of that then led to questions about equity. And while the definition needs to be focused on biology, we also want to make sure that it's accessible internationally, and that's part of why an international group was put together. And so then there was the question, well, what about countries where they don't have access to new medications like CGRP medications or onabotulinum toxin? And so that's where we got the concept of probable refractory migraine, because let's say you do not have access to those, so you're not able to have a true trial. You perhaps would be refractory migraine, but we'd have no way of knowing because you're not able to try all of the available medications that we have listed. But you're more than resistant because you've tried more than that. So that's where we came up with how we make this equitable, but still really focused on we want to understand pathophysiology.